The skull base serves for the attachment of the head to the cervical vertebra and for the passage of vessels and nerves into and out of the cranial cavity. And we can find 5 out of 6 skull bones of the cranium in the skull base. Namely, these are the orbital parts of the frontal bone, cribriform plate of the ethmoid, body and wings of the sphenoid, pyramid of temporal bone, and all parts of the occipital. The basilar parts of these bones develop via endochondral ossification that assumes the development of a cartilaginous matrix for each bone prior to its ossification. That makes the process a little bit longer, but it fuses all bones together very firmly. In adults, we still have a piece of non-ossified cartilage in the foramen lacerum, the space between the apex of the temporal bone, clevis of the occipital, and the body of the sphenoid. The base of the cranial cavity is divided into 3 distinct fossae, the anterior, middle, and posterior one, by the leather wings of sphenoid anteriorly here and by the superior borders of the pyramids of the temporal bones. The floor of the anterior cranial fossa is at the highest level and the floor of the posterior one is at the lowest level. Apertures of the skull base may be confusing in the beginning, but they are often mentioned in skull base fractures and in tumor growth case scenarios. If you memorize the key content of these apertures, it would give you the keys to these type of questions. So let's look at them. In the anterior cranial fossa, we have the cribriform plate of ethmoid bone. And the tiny openings in this plate serve for the passage of the filaments of the olfactory nerve, the cranial nerve number 1. The base of the leather wing of sphenoid is pierced by the optic canal, which gives passage to the optic nerve, the cranial nerve number 2. A tiny branch of the internal carotid artery, the ophthalmic artery, accompanies the optic nerve. The cleft between the leather and greater wings of the sphenoid is the superior orbital fissure, and it connects the middle cranial fossa with the orbit. The cranial nerves supplying the extraocular muscles and the branches of the ophthalmic division of the trigeminal nerve pass through this fissure. Additionally, the superior orbital vein enters the cranial fossa here to drain by the cavernous sinus. The greater wing of sphenoid has 3 apertures, the foramen rotundum, ovale, and spinosum. The foramen rotundum, the round-shaped one, is for the maxillary, for the second division of the trigeminal nerve, V2. Foramen ovale, the oval-shaped one, allows the mandibular nerve to pass. That is the third division of the trigeminal nerve, V3. The foramen lacerum gives passage for some autonomic nerve fibers. We'll study them a bit later in the neuroscience course. The smallest aperture, the foramen spinosum, is for the middle meningeal artery. At the apex of the pyramid, you can find the opening of the carotid canal. The internal carotid artery appears here, and then it runs forward along the sides of the body of sphenoid, where we can see the carotid groove here. In the posterior cranial fossa, we have the internal acoustic meatus for the facial and vestibulocochlear cranial nerves number 7 and 8. And below here is the jugular foramen for the cranial nerves 9, 10, 11, and for the internal jugular vein. And the hypoglossal canal, this one, it pierces the occipital condyle and serves for the passage of the same named nerve. Finally, the foramen magnum. Not only the medulla oblongata with meninges leaves the cranial cavity passing through this foramen, but that accessory nerve and vertebral arteries enter the skull. It takes some time and practice to memorize all these apertures, but as soon as you do, you'll have keys for at least 12 questions on the skull base, so it's time worthy. And additionally, you will have some time in the lab to grab the skulls and to identify all the structures, so don't worry. And I can demonstrate all these apertures for you on my 3D model to make it easy for you to find them in the lab. So here they are, our anterior, medial and posterior cranial fossae on the different levels. And you can see the cribriform plate right here in the middle with tiny apertures, foramen cecum in front, the optic canal right here, the superior orbital fissure. It's easier for me to show you where it is from the orbital side. Well, next come 3 apertures: foramen rotundum, foramen ovale and foramen spinosum. First, second and third, here they are. The foramen lacerum is here in the middle, and it kind of perforates the skull base. You can find the same aperture on the external surface of the skull base. It differs from the carotid canal, which is a little bit lateral to it, and it doesn't go straight down. It enters the pyramid of the temporal bone and makes some curve inside. Well, in the posterior cranial fossa we have the internal acoustic meatus, this guy here, jugular foramen, which resembles number 8. You see it has 2 parts. The anterior part is for nerves and the posterior part is for the vein. The hypoglossal canal here in the very deep and very posterior part of the fossa, and of course the foramen magnum. Don't forget about the external surface of the skull base. The bones of the facial skeleton contribute to its anterior part, and you can see here the lower surfaces of the maxilla, the zygomatic bones laterally here, palatine bones, sphenoid, vomer, temporal bone and occipital one. 2 important processes of the skull base are the styloid and mastoid ones. Both belong to the temporal bone, and here they are. And 2 articular surfaces may be found here: the mandibular fossa for the temporomandibular joint, and the condyles of occipital bone for articulation with the cervical vertebra. And of course some apertures. They are also visible here. The posterior nasal openings, also called choani, are here anteriorly. The inlet to the carotid canal. The jugular foramen rests just behind the carotid one. The stylomastoid foramen is here, and it serves for the exit of the facial nerve. Foramen lacerum is open only on dry skulls, you remember, but it is still closed in the wet spacements by the piece of cartilage, as I said before. And then foramen magnum. This one is difficult to confuse with anything else, right?